Hello and welcome to Digital Medboard. Here we go. The ovarian artery is a branch of the abdominal aorta, just like the testicular artery. Quick facts to remember. Although the ovaries and testes descends into the pelvis, they receive their arterial supply from the abdomen. This is because the ovaries and testes develop in the abdomen before migrating to the pelvis. Since they originate in the abdomen, their blood supply comes from the abdominal aorta. The abdominal aorta bifurcates into the common iliac arteries. Each common iliac artery further bifurcates into the external and internal iliac arteries. The internal iliac artery gives rise to the uterine artery. For instance, in the case of postpartum hemorrhage, if the uterus is bleeding, a ligature is placed to block the uterine artery to stop the bleeding. However, the uterine artery also supplies the vagina and the ovary. Due to anastomoses between the uterine artery, vaginal artery, and ovarian artery, there is collateral circulation. This means that blocking the uterine artery alone may not effectively stop the bleeding, as the abdominal aorta continues to supply the ovarian artery, which in turn supplies the uterus through collateral circulation. As a second step, the ovarian artery must be ligated. If the bleeding still continues, the next step is to ligate the internal iliac artery, specifically its anterior division. The posterior division must be spared because it supplies the gluteal region through its branches: superior gluteal artery, iliolumbar artery, and lateral sacral artery. If the posterior division is included in the ligation, the gluteal muscles and associated structures will be damaged. When examining the right side operative field, the right common iliac artery gives rise to the internal and external iliac arteries. We are concerned with the internal iliac artery, which has anterior and posterior divisions. Artery forceps are applied to the anterior division of the internal iliac artery. We got a question. A woman delivered a healthy baby, and to control her postpartum hemorrhage, an artery was ligated. Then later she developed pain under her gluteus muscle. Which was the artery ligated? Based on our discussion, in this case, the doctor ligated the main trunk of internal iliac artery, which includes anterior and posterior divisions. Leads to damage in the branch of posterior division, can develop pain under her gluteus muscle, result in ischemia. Therefore, option D is the correct answer. If you found this video helpful, don't forget to like, share and subscribe to Digital Medboard. Got questions? Drop them in the comments below. See you in the next video. Until then, stay tuned. Choose.